County Board of Commissioners meeting is called to order. Would the clerk please call the roll?
Pradham.
Here.
Matas Castillo.
Here.
McDonough.
Here.
McGuire.
Here.
Ortega.
Aye.
Reinhardt.
Aye.
Carter.
Here. We'll all stand for the Pledge of Allegiance. I think we will. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. The agenda of the August 3rd meeting is before you. It's a motion.
So moved.
Second.
Thank you for the motion and second. Any discussion on the agenda? Clerk, please call the roll.
Pradham.
Aye.
Matas Castillo.
Aye.
McDonough.
Aye.
McGuire.
Aye.
Ortega.
Aye.
Reinhardt.
Aye.
Carter.
Aye. The agenda is passed, and the minutes of July 27th are before you.
So moved.
Second.
Thank you for the motion and second. Any discussion on the minutes? Will the clerk please call the roll?
Pradham.
Aye.
Matas Castillo.
Aye.
McDonough.
Aye.
McGuire.
Aye.
Ortega.
Aye.
Reinhardt.
Aye.
Carter.
Aye. Thank you very much. The minutes are passed, and noting that we are all here in our masks today, we'll call on the county manager and our staff for our COVID update.
We just didn't want to lose the muscle memory, Madam Chair, so we figured we'd try again. We have a full update today, so we'll dive right in to a series of topics, and I'm going to ask Public Health Director Sarah Holly to take a number of items. We're going to cover vaccine updates, case rate updates. I'll come back at the end to talk a little bit about the emergency wind down and how we can do that during a time even when we see Delta case numbers doing what they're doing. And we'll conclude on a conversation about masks and ideas going forward. So we'll start with the data and then come back to have that conversation. I'll turn it over to Director Holly.
Thank you.
Good morning, County Manager, Chair Carter, Commissioners. So a lot has changed as of last week with the Delta variant continuing to be of great concern to all of us. The highly infectious Delta variant continues to be dominant. It continues to be the dominant strain in Minnesota and in Ramsey County and across our nation. As of last week, the level of community transmission in Ramsey County shifted from moderate to substantial in a matter of days. With all of the 7 county metro areas seeing this same trend and with a high level of community transmission across the United States. Since the last update on July 27th, there have been 80 new cases of COVID reported in Ramsey County. And I just want to kind of pivot to talking about some of the key points that the CDC issued as of last week. Really top 5 things. So the first thing I want to stress is that getting vaccinated prevents severe illness, hospitalization, and death. And it also helps reduce the spread of virus in communities. Unvaccinated individuals should get vaccinated and continue masking until they are fully vaccinated. Big stressor there. With the Delta variant, this is more urgent than ever. The highest spread of cases and severe outcomes is happening in places with low vaccination rates. Point 2 is that data show Delta is different than past versions of the virus. It is much more contagious, and I think we made that point last week. Some vaccinated people can get Delta in a breakthrough infection and may be contagious. Even so, vaccinated individuals represent a very small amount of transmission occurring across or around the country. In areas with substantial or high transmission, the CDC recommends that everyone, including fully vaccinated individuals, wear a mask in public indoor settings. Point taken today that we all have our masks on, to help prevent the spread of Delta and to protect others. Point 4, the CDC recommends that community leaders encourage vaccination and masking to prevent further outbreaks in areas of substantial and high transmission. And the last point that I want to make is that the CDC is also recommending that universal indoor masking for all teachers, staff, students, and visitors to our K-12 schools, regardless of vaccination status. And one thing that I think we've heard on the news this morning and across our nation is that our medical professionals are encouraging that children should return to full-time in-person learning in the fall with layered prevention strategies in place. And I just want to say that we cannot stress enough that children 12 and under should continue to wear a mask in public places and around individuals that are not fully vaccinated. Our incident management or our incident command system will continue to monitor the level of community transmission very closely as we try to mitigate the impact of this new variant. So I'll turn it over to Incident Commander Laura Anderson to give the rest of our COVID-19 update. Thank you.
Thank you.
Thank you, Director Holly. Board of Commissioners, apologies. I am actually participating today remotely, and I'm sorry I'm not on screen, but hope you guys can hear me. Sounds like you can. Mike, I would like you now just to quickly display our open data portal on vaccine, if you would.
It's up, Laura.
Thank you, guys. So I want to issue a reminder here as we move forward with this new information on our caseload. Along with masking, we are in a different place. We have access to vaccine, and it's very effective at preventing hospitalization and death. All the vaccines that we have. So as of yesterday, 74% of our residents ages 16 plus have received at least one dose of the COVID-19 vaccine, and 72% of our residents 12 plus have received at least one dose. Our colleagues in operations tell me that we have seen an increase in interest among residents around receiving vaccines, so that's some good news. We continue to make progress in a couple of zip codes that we had concern given lower rates of vaccine. We've seen increases of 8 to 11% in all three of those zip codes over the past 2 months. So that's good, steady progress. Alongside those vaccine metrics, we continue to monitor the percent positive found through testing, as well as weekly case rates. One challenge that we identified over the past week or so with regards to our existing metrics is that we did not consider quick changes in time. So I'm going to go ahead and ask Mike to quickly display the CDC's data tracker, which I believe many of you have had a chance to look at as well. Is that up?
Yes, Laura, it's up.
Thank you. So this is a very useful dashboard for all of us to be monitoring routinely. The nice thing about this new data tracker is that it combines caseload as well as test positivity over the past 7 days. And I'm not sure if I'm going to challenge Mike to go ahead and scroll down to the Your Community tab and actually plug in the data for Ramsey County if you can. The reason why I'm asking us to actually visually display this and share it broadly with our community is that you're able to see across the board, not just for Ramsey County, but Minnesota, other states, other communities, you can see how quickly our case rate is expanding due to the Delta virus. Our cases per 1,000 have doubled over the past 7 days. So we're still seeing, lower cases than we saw earlier this spring or last fall, but clearly we're having an impact, the Delta virus, is having an impact on our case rates. The CDC is using data from this particular tracker to recommend indoor masking. Just an FYI, this recommendation came about, I believe, 3 months after the federal government initially lifted mask requirements. So I just want to go ahead and share that with you now, something for you to bookmark or consider as we move forward in making decisions. The last thing that I want to note, moving back to the vaccine dashboard, if you can, Mike, looking at our current impact as a public health department, we've been able to deliver more than 54,500 doses at 303 cases since the end of December. And next week, we intend to administer about 250 doses. We are looking forward to seeing more individuals attend our vaccine clinics. And I think that, incentive programs at both the state and the local level will certainly help support that. So I will now go ahead and pass the mic to my colleague, Dr. Lynn Ogawa, for more information on the Delta virus. So thank you, guys.
Thank you, Laura.
County Manager, Chair Carter, Commissioners. I was just going to touch briefly on, and a little bit more specifically on what's been noted before, and that is that the Delta variant is changing the landscape of transmission. And so it is more infectious, likely because it actually replicates to a higher level in those who are infected, which is also why we believe and we're seeing, and again, this is science that's changing on a regular basis because we're monitoring things so closely, likely because it replicates at a higher level, even in those who have been vaccinated, it is potentially transmissible, and that's what we're seeing. So we are in a very different place for deaths and hospitalizations because we know that the vaccines protect against those, which is what we want to see. But for transmission, we are still learning that the vaccine may or may not fully protect against transmission. Hence the need for other mitigation efforts like masks to reduce the risk of transmission. So again, there are still lots of very good reasons, and vaccine is the best way to protect yourself. But the way to help protect others and the way to reduce transmission is through masking and other mitigation efforts. Lastly, the issue with the vaccine itself, there's still a great deal of information, and we want to make sure that people recognize that they're effective, that they're safe, and that they still are the best way to protect yourself. So we're available for more questions. I'm going to turn it back over to Sarah or...
So, Madam Chair, I'll close this out, and then we can take questions on a variety of issues as we go. As I mentioned, masks have obviously, so the vaccine rollout continues, and there's no change in strategy there. We continue to look for every opportunity to spread the vaccine, and you received the update on vaccine incentives here in our community, trying to eliminate barriers, even to access those incentives, which have been a concern for us in the past, in hopes that it will continue to spur more people to get the vaccine. I would also say, as we talk about masks, one of the good reminders I got this week from Deputy County Manager Hadeen was a reminder that the pandemic is nonlinear in terms of its progression. And it's an ask for patience, and it's an acknowledgement of the frustration and exhaustion and exasperation and every other word, adjective you could think of that people experience through this time. I think it's important for us to acknowledge that and not be stoic in the idea that this is all easy or charted out somewhere where it's simple to decide where to go. As we have talked about masks internally over the last week, involving buildings operations staff, public health, communications, others who have been close to the work, we're seeking to balance good information with the highest level of compliance that we can reach, flexibility, recognizing that today's conversation actually bleeds into next month and potentially the next 12 months. We also want clarity and simplicity of implementation. The idea of rewriting an administrative policy and changing it each time internally is a consideration, and at some point people will stop reading it. And if that is what we are relying upon for compliance, I think we miss the maximum compliance opportunity available. So we balance that with the ideas of what is needed to ensure as many people stay safe as possible. We also look around, and you've probably noticed the same. Ramsey County, to residents and employees, have a higher natural rate of compliance right now in terms of people being willing to wear masks, to continue to believe the information that was shared here today. We see that in the behavior that's here. So how do we build upon the goodwill and the collectivism that we see across the community using the tools that are available to us? As you received on Friday a brief outline of the proposed plan forward, this would not require a change in the county board's current approach or policy, nor would it require us to again change the administrative policy manual. What we are suggesting is using the CDC information that is updated every day at 7 o'clock. I believe that's 7 p.m., but it's 7 a.m. or 7 p.m. Once every 24 hours at 7 o'clock, the information is being updated on their dashboard. Our Public Health Incident Command has a targeted way in which they will monitor that information. There are 4 levels. It is 7 o'clock p.m. Thank you. There are 4 levels of criteria in terms of the potential place you can be placed. You can be in low or moderate, substantial, or high. Last week, Ramsey County moved from the moderate to substantial. As we think about those 4 tiers, What we are suggesting is that whenever Ramsey County is classified by the Centers for Disease and Control, CDC, as an area below substantial, so low or moderate, we would remain consistent with where we've been for the last number of months, which is a strong recommendation that unvaccinated individuals wear masks. And that'll be posted very clearly on our website, social media channels, on RamseyNet, on our doors at all of our facilities. Clear signage, you'll see the mock-up of everything that's being developed as clarity. It'll be done hopefully today, no later than tomorrow. And so it'll have a very clear piece around the unvaccinated strong recommendation. When we move into a moderate or high-risk category, we will change out what that language and signage looks like. And the language needs to be simple and clear. The color scheme will change. It will look more foreboding, I guess, for lack of a better term. It'll be more clear about the level of hazard or risk in front of us. The graphic design team's been doing a great job thinking through the visual cues through color and design that you can use, and it'll be clear that it is a strong recommendation for all individuals. It's not going to say unvaccinated. It does not distinguish at that point. It's saying when you enter this building, we are telling you, you should have a mask on. That is our recommendation to you based on the information and the health situation around us. Just like today, where we're trying to model where we're moving in that space, we have masks over by the agenda. We continue to make masks available in our facilities to the public so that that is not a barrier to compliance as people go. I think there's always a question around compliance. And I would say whether you are mandating masks or you are strongly encouraging masks or you are saying nothing, there will be some element of human behavior in terms of how we work. But we do believe by being as clear as possible in how we post and the expectations, you can mitigate those concerns significantly. Our staff have been up to every challenge so far in terms of complying with where we're at on masks. I get the general sense that most people don't want to get sick, nor get their colleagues sick, and they want the best information possible to them at any given time. The goal of this process and protocol is to be able to live with us without having to have a conversation about masks every time the CDC makes a change to status, which is an important marker that we can put out more broadly into the community and in our current work with our cities. I probably left something out, but I want to thank communications, public health, property management for working through all the specifics on getting to the outline proposal we just discussed here today. Finally, I'll end on the emergency wind down, which is a weird place to, in some ways it feels like end while talking about this, but I'll actually use this as an example. We do not need the incident management team to develop and implement the protocol that was just laid out for you. And the goal of an incident management response is when you don't have capacity, you marshal resources and people to have the capacity. We have, unfortunately, over 18 months of practice, been able to develop that capacity through the public health incident command structure, through our communications team, through property management, to where in my normal role as the county manager, I was able to help develop and implement a proposed response using process and protocol. So the end of the emergency is set for 11:59 tonight. In reality, what it means is an end to procurement tools that we do not believe we need to bring to bear anymore, which brings us back to just classic ways of doing procurement, which is a good accountability and transparency step for the public. My commitment is that if we are experiencing barriers in real time, we will raise that here with the board and ask for your support to help us through those moments if and when they arise, but we just don't see them right now. We've hit a new point in where we're at. We are going to bring forward later this month an opportunity to celebrate those who have served on the incident management team, some for the entire time since the day it was stood up till the end. Yesterday was the final Monday collective of that group, and I was able to spend some time with them. And we are now transitioning to where public health continues to stand up in an incident command structure because the vaccine push, the continued need to digest science is far from over. So we are not done. We're scaling back to the appropriate level as we move ahead. Thank you, Madam Chair, for letting me give that long-winded update, and all of us would stand for any questions or comments you may have.
Thank you, and I do have questions around the table. I would just want one point of clarification. As you talked about the CDC website and you spoke about where we are, there are 4 levels: low, moderate, substantial, and high. As you mentioned, the sustainability, flexibility, clarity, simplicity of our new approach. You spoke about moving from moderate to high. You left out the substantial, which I believe is where we are today.
I apologize.
That's fine. I thought that was probably just misspoke. But also then, I would have a question about our ability to monitor our movement from substantial to high, because I did not hear clarity around that. We're at substantial now, and the proposal that is before us to be implemented at an administrative level would be that at that rate, we exercise the strong recommendation for all to wear masks. Would there be a change should we move to that high category?
Thank you, Madam Chair, Commissioners. The short answer is no, although I don't want to give some level of oversimplistic information for things that we continue to learn as we go. The concern we have is too many tiers becomes even more confusing. However, if we see concerns around mask compliance or continued just out of control spread over the next month, we're going to need to revisit our approach, and we need to remain flexible and open to those ideas. This is a marker of us trying to create a level of clarity and simplicity, recognizing that we are only as good as the information in front of us. And yes, I did misspeak. We are not in the high category. We're in the substantial. You reminded me of one thing I didn't mention. As we look at our flexible workplace policy and bringing individuals into the office, anytime we are in the category of all recommended for masks, we're going to pause any additional bringing people into close indoor proximity to one another. We're not going to change our service delivery as it's been designed. There's a process for that to submit and make changes. But we're not going to bring more people back into office settings if they have an opportunity to work flexibly. I would almost think of it like a long snow day, and then we will resume when we tick back down into the category of unvaccinated instead.
Thank you. I know that there are a number of questions. I appreciate your response there. I'll turn to Commissioner Ortega, Commissioner Reinhardt, and then Commissioner Matascasio. I think I saw you also.
Thank you, Madam
Commissioner
Chair.
Ortega.
My question has to do with, let's start with Ramsey County. Are we reflecting the general population throughout the country, I guess, in terms that our rise in numbers is due to the unvaccinated?
Chair Carter, Commissioner Ortega, essentially yes, and we're seeing the same kind of mirroring of the Delta variant being also behind the rise. The good news is our rise is ideally not as steep as the areas where the numbers of unvaccinated are as high. However, we still are concerned about that.
And do we know if our rise are in those precincts that we've been trying to raise the numbers?
That's a little bit harder based on the numbers that we're seeing for me to pull off the top of my head. I think we'll need to look a little bit closer at the individual cases for us to be able to say that specifically. So I'm hesitant to, yeah.
And and if we look at the rate we are going, I'm trying to get ahead of the game instead of just listening to reports about what happened last week.
Yep. Yeah.
Trying to figure out where we're going to be 2 or 3 weeks from now.
What's difficult, I apologize for also sort of cutting you off. What's difficult is that all of this is new again because we have different things that are affecting it. Vaccine is affecting it dramatically. So when we say the rates are increasing, and yes, they are mostly in the unvaccinated, and we have an average, right, of those who are vaccinated, it's a little bit difficult to predict what our curve is going to do. We are making the recommendation in the same response, in that we want to get ahead as well. So we want to rely on the mitigation efforts that we know to reduce transmission. And besides vaccine, the best option we have is masking and distance and washing hands and all of those same mitigation efforts that we have related to transmission of COVID.
Okay, so just
Go ahead.
so then going back to the questions that I've been asking for the last 3 weeks, when it comes to the kids and the unvaccinated, that's where I see the biggest potential spike. Do we have any sense? I mean, we know through the news what the schools are doing. I mean, I just want to get handoff potential, is that, I know we can't predict, but is that a place that we should be putting more attention to or tracking more completely, or?
Chair Carter, Commissioner Ortega, what I'll share is that that is a big push of ours. We are working hand in hand with the school systems, providing vaccine in school settings, specifically reaching out to families, not just students, not just teachers, not just, but also the community surrounding those schools. So we are very cautious because we want everybody who can be vaccinated to be vaccinated. We also want the safety, so we're working close with our schools about the recommendations from the Department of Education regarding masking for everyone within the school systems, for those under 12, for everyone, regardless of vaccination status or age, because we are focused on those communities and those populations.
Doctor, I just would add one thing to that, Commissioner Ortega. So of all the presenters here today, most or all of them were in conversation with the superintendent, for example, in the St. Paul schools last week, and or top staff, I know in particular, and that extends to our other school districts as well, just as the largest and as they're thinking through this. The reason I know is I spent time with him and then followed up, and everybody I followed up with had already been in conversation as well. And they're getting close to finalizing their approach. I feel like it is definitely in alignment with Ramsey County St. Paul Public Health guidance and support in terms of what they are looking to do. And so I do appreciate that partnership, but it's an ongoing, almost daily dialogue happening right now.
And then one last comment, if I may, and that is, you know, it's easy to say that we need to communicate simply. What I'm hearing from a lot of folks at this point is that from all the way down, it's getting more confusing. Yes. Okay, it's just, so, you know, this CDC could say from substantial to high. That doesn't mean diddly what to 90% of the people I talk to anyway. There's got to be a way for folks to understand the urgency of what could potentially happen here. And I don't know that by copying that same language, it's going to be helpful at all. And so I'm trying to get away from mimicking what my constituents are telling me. I don't understand what the hell you guys are talking about anymore. And the back and forth, you know. And so I just want to bring that out, that we got to come up. So even I don't know what the substantial to high means. You know, are we in, you know, in real danger within the next couple of weeks, or, you know?
I see Director Holly has stepped up.
Yes, and Madam Chair, Commissioner Ortega, great point, Commissioner Ortega. And I think this is where we can work more closely and leverage our trusted messenger and community connectors. And I would say the simplification of messaging is going to be key here, right? And visuals are important, but the messaging, the translation of information is going to be important. So I would say we're at, I think, at a good advantage right now, because we are going to be working with our connectors through the end of August, and we will continue to explore that in partnership with research to see where we need more messaging, where people need more information, where there's, you know, where there's confusion, right? Because I definitely think the points that I made this morning and that Dr. Ogawa and Laura made, I think there's a lot of information out there, and people want to know what's factual, and we want to make sure, and that's the biggest thing with the Trusted Messenger initiative, is that people have accurate and factual information, right, and up-to-date information right at their fingertips that people can digest. So I would say we need to continue to leverage those connections right in our community and getting that information, but also making sure that people can get their questions answered in a timely manner. So.
Well,
Thank you.
Just last comment, and Sarah, what I'm trying to get to is that I want Ramsey County to be the trusted messenger.
For sure.
Because whether it's the federal or the state, most folks, you know, that are out in the street are confused with all the levels of government, sometimes coming at it from a different perspective. And so, you know, the point is,
We should be the trusted source.
we should be the trusted messenger.
Correct, and I
Thank you
think
for
we've
that.
seen some of that too. Sorry.
Go ahead.
Chair Carr. I think we saw some of that back in December when we were working to develop messaging, communications in partnership with community, and making sure we had consistent language and messaging going out to community. So we'll take that back and talk through that, but I think that was what community asked us for. Is the messaging, we'll translate it out and get it out to our communities and the residents that we serve.
Thank you for this important
Thank
point.
you.
I'm going to check in with you,
Thanks, Madam Chair. I'll keep it brief. The visual needs to be as simple as a switch that says either all or unvaccinated for the very reason Commissioner Ortega is citing. And that's why we're trying to move to take the language away from it and make it as clear and simple and concise as possible.
Thank you. Commissioner Reinhardt.
Thank you. Well, all through this, there have been certain times where we refer to COVID fatigue. Mm-hmm. I think this has gone beyond that because with the vaccinations and all the things that we've done, clearly we're doing a good job. But with this new variant, and there may be others too, as we go along here, I think it's important to recognize that not only are we tired, but everyone is. And the more information, the simple message of, this is a high alert time or substantial or whatever. I mean, it's just, those words don't mean a whole lot. I think is what Commissioner Ortega was saying as well. It's like mask up, get vaccinated, and when it's really important, we're making sure that people understand that this is not really an option. So I guess I think it's important to recognize that because we're all in the same situation as far as just feeling like there's so much. I do have a question about, is there a point, I mean, if you get to that highest level, where we will look at mandates, and how will we flip that particular switch if we do? Either mandates that you need to be vaccinated, as many employers are doing right now, or the mask as well. So could you talk a little bit about that, and then I do have another question.
All right, we'll go back there.
Madam Chair, Commissioner Reinhardt, on the mask mandate piece in particular, the answer is yes. I mean, we could hit that level, and even if we are concerned that we're not seeing compliance as we need to, then that's a conversation we'll bring back here at a future COVID update as we go and ask for a reconsideration of our policy in all public spaces, for example. We're trying to build on the goodwill and momentum we think we found with the community and our employees, and we're going to start there and see if that works or not. On the vaccine mandate side, it was a good question that came up last week. I think it's going to continue to be in front of us. It's a piece where there are conversations happening across the organization too, to feel with some of our partners and other places like what the different feelings around this are from the outset. I think it's important to get an understanding of how people feel, what are they hearing on the ground, and what does that look like day to day? What are people's fears or hopes? I could argue all sides of how people might approach this, and so we're trying to be thoughtful now while we have a little time in the build-up. Those conversations are happening. I don't have anything specific to report today, but absolutely reading the same things and seeing the trends. And the more clarity in this space that happens at the larger the level, the better for every employer, including Ramsey County.
I appreciate your going back there, and indeed, day by day, there are changes and new responses and requirements for vaccinations, requirements for masks at our universities, in businesses across the Twin Cities area. I appreciate your asking that question, and certainly we need to be certain that we understand how we'll monitor in that process. The CDC levels help us in that regard, monitoring compliance, as you have stated, to observe our experience as well. Commissioner Reinhardt, did you have follow-on there?
Yes, I have, just as far as I assume that we're going to be hearing a little bit more about the incentives that are potentially coming out. Is that today, or are we going to hear that at a different time?
Madam Chair, Commissioners, if you'd like to hear more, we can share more. It's $100 across a 2-dose or $100 for a 1-dose Johnson & Johnson shot. The state's requirement requires you to fill out a form and submit it to get reimbursed. Ours requires none of that. We'll provide you with the incentive on the spot, which we hope will drive greater compliance.
And I think that that's an important message to get out there. And I know that I guess bottom line is we have to think about what the goal is, because there are some people that are going to say, well, I got the shot and I didn't get an incentive. Well, yeah, you did, because you're alive, and you're keeping other people safe, because that's really what the mask mandate is for, is keeping other people safe. and the vaccination is to keep you safe. And so that combination is what is going to help. And I think that, again, noting the number of children that are now being infected and becoming sick, and with school right around the corner, with the state fair right around the corner, I think that those are very compelling reasons to, get the information that you need. Because I understand if there's a fear or a concern, get the information that you need, and hopefully that can allay your fears. And I guess I will end with one of the things that I thought of this morning. Actually, Commissioner Matas Castillo said something and it jumped into my brain here, and that is the Bee Gees song, "Staying Alive." That's what this is about.
Thank you. Commissioner Matas Castillo.
Yeah, thank you, Madam Chair, and thank you, County Manager, for all the updates, and of course, our public health team. I have to tell you that I appreciate all the work that's gone into this and all the work to figure out what's going on. I'm with Commissioner Ortega that this is still super complicated and confusing. And I actually think the only two things we know for sure is vaccines will save lives and masks help mitigate. And until all of our kids have access to vaccines, I honestly think that we should make this a pretty clear statement of, if you're in a Ramsey County facility, if you are indoors, you wear a mask, until our kids have access to vaccines. We know how many of our employees are parents and have children. We have employees who have grandparents and with small children that are not vaccinated. And we are risking the lives of an entire generation by flipping back and forth and causing confusion. I think we need to mitigate the safety of our community and our children. And that's a really clear cut. If you're in the building, wear a mask. If you're outside, you can take it off. Until a year from now, maybe, that we have widespread access to vaccines for our children. I appreciate all the work, and I appreciate the taking and feeling and compromise, but I actually think it's too big of a risk, it's too complicated, and we need a black and white, bold statement in Ramsey County.
Thank you, Commissioner Matas Castillo. We're going to go around. There are a lot of thoughts here at the table. I'm going to call on Commissioner McDonough, then Commissioner Fretham, and then Commissioner
Thanks, Madam
McBride.
Chair. I'm going to just continue this. We're moving too slow. We're not being responsive enough. This is moving very, very quickly. Your whole thing was on masks, and as Commissioner Matas Castillo pointed out, that's a mitigation. That does not prevent this. Vaccines are the only thing that prevent it. We got the state of California, we got New York, we got the doctors, we got the nurses, we got everybody. We got the federal government on the verge of a mask or a vaccine mandate. You didn't mention anything about vaccines in your presentation. That's what stops us. We are here today because people chose not to get vaccinated. I'm wearing a mask today because people chose not to get vaccinated. All the mitigations we're talking about are the impact is on people that are already accepting this and taking a responsibility for their people, their neighbors, the people they live with. And we're not talking about things that actually put this back on the people that made choices, that took us back to this position. It is clear, the data tells you, the reason we're here is because people chose not to get vaccinated. I've seen 85 to 99% of all the infections right now are the Delta variant, and they're with people that have not been vaccinated. I mean, the Vikings, if their players choose not to vaccinate, they got to get tested every single day before they walk on that field. Every single day. And we can't wait. I don't care how good they feel, Ryan. I really don't care how good they feel about this. I care about all the people that have done everything possible in their role into ensuring that we get an end to this pandemic. And that means now we've got to start looking at the impacts at the people that chose not to get vaccinated. And we got to start looking at the strategies that protect us from those people that have chosen not to get vaccinated. And whether that's testing requirements, whether that's an outright, you don't come into our building unless you're mandated. But I don't want to hear any more strategies about wearing masks. I want to hear strategies about actually preventing this disease from spreading. And that means vaccines.
Thank you, Commissioner McDonough. Commissioner Fretham.
Thank you. So lots going on here. I want to say I would support at least leading forward with our staff with some sort of incentive for vaccination, even folks who got vaccinated right away when they should have. And if we can use some of our ARPA dollars to promote that, to make sure our staff are safe, I would be supportive of that. In terms of a broader mandate, I'm not opposed to that. Certainly, I have a 5-year-old at home who can't be vaccinated and who really wants to start kindergarten this fall, and I really want her to be there. And we're doing what we can, but there's a family in my district who have a child who's high risk for COVID complications, who got COVID initially before vaccination. Their whole family is vaccinated now, and now at least 3 out of the 4 of them have been reinfected with the Delta variant. So this is for real. And I keep trying to reiterate that to folks. And it's very scary. And I want to support our businesses and school districts and cities in making good decisions. But I'm also willing to be the scapegoat and the bad guy if they don't want to take the flak. So if that means us moving forward with some sort of broader mandate, I think that, especially for our school districts, I've got concerns from parents in our school districts that their school district isn't acting quickly enough or forcefully enough to protect their children. And there's still a lot up in the air, but if this takes the burden off our school board members to say, you know what, we're going to make the decision for you and do an ordinance right now, I'm willing to be the bad guy and the mean mom, because I'm really good at that, I've been told. That's just what we need to do. I think for folks who have chosen not to get vaccinated, who can, I think we want to be really clear that it's not a punishment for not being vaccinated, but there are consequences, and you need to be accountable to that choice. Pre-COVID, when I was running a childcare program and I had families who opted out of vaccines for their children, I let them know, look, you can come here, but if we have a case of something that your child is not vaccinated for, the public health protocol is you don't come to my program for X amount of weeks until I know that it's gone and your child is not spreading it. And you need to continue paying me for that time because you have a contract with me. And so there is a consequence to making that decision. You need to be accountable for that. And whether it's, like First Ave, you can't go to this concert unless you show me that you have taken a test in the last 3 days or that you have gotten your vaccine. Those are accountability and consequences. And at this point, I am so concerned about folks who have made the public health decision and gotten vaccinated, and now that they're getting reinfected because other people aren't making safe choices. And how do we ensure full accountability and that everyone is being responsible for the full consequences of their choices? Not in a punitive way, but just in understanding you can do this, and you may be aware of, fear risks involved in that, but there is also a risk involved in this. And at this point, everyone is getting immunity one way or another, whether it's through a vaccine or getting infected, you're going to be immune. So I guess it's up to you to choose what risks. But if you choose, I'm going to go ahead and get infected, then we need to take measures to ensure that people are safe around it. So I'm open to exploring something stronger. On the other hand, if where we're at right now, if that's going to take some time to build and to connect with communities, if we're doing a more communications and recommendation-based approach, I want to make sure that we're being really forceful with it, not just at our buildings, but are we doing social media ad buys so that people, wherever they are in Ramsey County, are seeing, oh, this is where we're at? Are we putting it on billboards around the community so that you don't have to seek out that information? That information is in your face, whether you're at the door of a Ramsey County building or on the Ramsey County website. So if we're doing a more recommendation-based approach, I think it needs to be more forceful so people don't have to seek it out, because there are a lot of people who just don't know that we're at substantial transmission and what that means. So it's got to be everywhere in their face with multiple touches for that to be a workable approach.
Thank you. I'm going to call on Commissioner McGuire, and then we'll check back in as this discussion has taken some turns here.
Yeah, thank you,
Commissioner
Madam
McGuire.
Chair, and there's a lot being said here, and I don't necessarily disagree with anything of what my colleagues have been saying. This is a really important issue, and it's really crucial that we take the right measures to protect ourselves and our public. So I have a few questions. I mean, a lot of it has been said. I think it is about vaccines, but we have a lot of kids who can't get vaccinated, so then it's about the masks. So it's about both, as far as I'm concerned. I'm not opposed to a mask mandate. I don't know how we enforce that, so I would love some information on how that could happen and what that would look like in our buildings. Commissioner Fretta mentioned immunity, and I would love to ask Dr. Ogawa is how much do we know about immunity with these things, because I've heard mixed on that. And then while Dr. Ogawa is up here too, I just have this curiosity about, this vaccine, we keep saying how different it is, and we're learning every day. So just to confirm, it is different than other, not vaccine, but this virus and the vaccine, but this virus is different. So a lot of people that, are here may remember the polio vaccine, and all these vaccines that we had when measles, mumps, that we've all gotten. So I think we all think about it that way. So if you could just, I know we don't have a lot of time, but don't go into all of the science about it, but maybe just talk a little bit about why this might be different, and why if people are thinking, well, I get my vaccine, I'm good forever, and it's going to go away because we're going to get enough people there. I mean, I think there's just enough different about this that we really do need to take this as seriously as we all are taking it. And back then, I know they did take it seriously. So that's my question, and then I have another question too, but I'll let you talk about that, and then I'll ask my other question.
County Manager, Chair Carter, Commissioner McGuire, thanks for that question. I think it is important for us to recognize that this vaccine and this virus are different than what we've experienced before. We have not had a worldwide pandemic in, luckily, my lifetime, and I'm hoping we don't have another. But it is different, and it is rapidly changing, and we're learning things again on an hour-to-hour basis. My colleagues and I have commented. It feels like we're back at the beginning of the pandemic, and in some ways we are, but in many ways we're not. We now have a safe, effective vaccine that limits, again, death, hospitalization, but it doesn't completely protect against transmission and infection. Initially, we thought it was doing a better job of protecting against infection and transmission, but the virus changed to fight it. That's what's brilliant about viruses, unfortunately. Their job is to survive. Our job is to stop them. Their job is to figure out ways to get around our ways to stop them, and this virus has, not cognitively, but evolutionarily. So those who are vaccinated are protected, and we're getting that data, on mostly death and hospitalization, but none of our vaccines have ever been 100%. Many of the reasons that we don't see the other infections that we used to, like polio, like some of the other things, is because we reached that true herd immunity of being able to have everybody vaccinated so there could no longer be transmission, so that there could no longer be variants. We're not there yet with this vaccine either. And as long as there is transmission, there will be changes by the virus.
Thank you. Thank you. I appreciate that, and I think that's important, that you need to get vaccinated, but everyone needs to get vaccinated for us to get to that herd immunity point. Thank you for that. I can't remember do we require our employees to all be vaccinated in Ramsey County?
So that is a part of the discussion,
That's a
right,
part of this
at this point
discussion,
in
right?
time,
Because
yeah.
I know that's what businesses are now talking about doing, and of course a number of businesses are requiring all their employees to be vaccinated or testing every day, and what that would look like.
So
those are my questions.
I thank you so much for raising those questions about immunity and then headed toward the vaccination question. I know Commissioner Reinhardt has another point to make, and then we'll be turning to County Manager O'Connor for his reflections on the discussion we've just had. Commissioner Reinhardt.
Thank you. Well, as I'm listening to folks, I guess I am really thinking that the easier way to do this is to say it's a mask mandate until we say it's not. And we had mask mandates before, and yes, enforcement is an issue. But I think we really need to look at that very seriously. And actually the question about staff being vaccinated was actually part of the other question. Do we know right now what % of our staff is vaccinated?
I'm looking at public health. I see a
Okay.
We do not know.
Because, I mean, when you think about it, we're here and we're talking about this, and people, I think, would assume that when they come into a Ramsey County facility, especially, you know, in public health and some of the other places where there's really a lot of contact, that they would be safe. Now, if we have the mask mandate, that helps with it, but I do think that we need to at least look at that to find out what percentage are. And I know that there are some reasons why people can't, but I think that that's a pretty small percentage. And so I don't think that it's the difference between it being a choice and something that you can't physically handle. And I do think, and I thank Dr. Ogawa again for the information. Even the vaccines that we have right now, when you look at what they promised would happen, it has. I mean, I think one of them is like 5 out of 20 will get sick. But they're not going to die, and they're not going to be hospitalized. And that's really the most that you can expect. So I think that, you know, we just really need to make sure that people understand that this is serious and that it's not over because people wanted it to be so badly, but it isn't.
A lot has been said, and I know that the discussion points that we have just shared have been heard, and I really appreciate the opportunity for County Manager O'Connor to reflect on those with us as we move forward.
Thank you, Madam Chair and members. I appreciate the comments around the board. This is all, there's no linear, like we talked about, it's a non-linear piece, and it's important to hear the feedback and comments from everybody here. We'll come back next Tuesday with a proposed approach to move from both an incentive wrap-up to a vaccine mandate aligned with somewhere around like the Labor Day timeline of when people would be asked to return more into the office spaces and schools are coming back. We'll have a draft for you. It's important to hear where everybody else is at because we have to do this work together. I would like to say it's not a lack of action or the belief that it's not about vaccine solutions. I firmly agree with the comments shared here. It's that we must move as a collective, and this is how we get to have those conversations about it. So I appreciate that feedback. We've heard it loud and clear. We'll come back next Tuesday with a proposed approach on how to do that. We'll come back with a proposal for a mask mandate. I will say I have actually more reservations in that space than I do on the vaccine side of development. And I'll just share that compliance by the end was extremely lax. Compliance is difficult to enforce. Our staff have jobs to do beyond being mask compliance, and we'll balance that. We'll think about that. And I actually, in the proposal brought forward today, think we achieved the same thing without needing to go all the way to a mandate, which then asks the question of if you move into a lower category, what are we going to do? We will balance that. I'm not leaving that question here. I just want to speak about that out loud. And we'll think about the right approach. And the goal will be to rewrite our policies, both administrative and anything we do with our buildings, in a way where we're not asking to come back every time our CDC status changes. That's more important actually to me than the issue of the mandate piece, is figuring out how to allow it to be scalable, because otherwise it does inject confusion of where will you be on any given Tuesday. And I would like us to try to present the clarity and simplicity as we heard here around this conversation. So we will be back next week with an update on the mask piece, a stronger declaration in that space, both on staff and for people entering Ramsey County buildings. And we will come back on the vaccine incentive for employees moving to a mandate requirement. We have some ideas of how we can do that, and we'll be back in 7 days. Thank you.
Thank you. I do have Commissioner Ortega and then Commissioner Muscatine.
I just want to say, rather than, I don't disagree with anything you said, except for maybe the timing piece. I don't want to be the level of government that does exactly what you claiming, that is every other week, flip-flop one way or the other. But rather that we take our time to make sure we have a policy, maybe that policy, and giving it more thinking, that policy will have triggers. So, do you understand? So it isn't just a jump in and jump out type of thing over time, but that we clearly take time to figure out, what does it mean to go from, substantial to high? I mean, I don't even know what that means, to be honest with you. So, and then what happens if the dial does move up in terms of some of these, rather than a black and white type of thing, or, one or the other?
Thank you. Commissioner Mascastillo.
Yeah, thank you, Madam Chair. Because we have just had a good conversation, I am left confused. And I think that if I'm confused, maybe people watching, and it would be helpful if you clarify where we are today until next Tuesday when we come back to a policy. What's the requirement on masks in Ramsey County today until next week and in our building?
As of Madam Chair, Commissioners, the policy previously adopted by the board is the current policy, which is a recommendation to wear masks in buildings. It's not a mandate piece on it today. If the board, I just don't have a request for board action in front of you. If the board wanted to, on the fly today, add a motion during votes, during administrative items, if there was a desire to say change the policy to include a mask mandate starting tomorrow and revise the existing policy, I could take that direction and make that change occur. And we could then do that. I would just need the board to make sure they're making a declarative step in that direction so we're not running counter to the previous policy as adopted.
Got it. Thank you for that clarification.
Commissioner McDonough.
Yep, thank you, Madam Chair. Ryan, thank you for that. I appreciate you listening to us and laying out a thought here about between now and next Tuesday. And Commissioner Ortega, I appreciate, being thoughtful and deliberate about this. That's important, right? I don't want to do nothing on the fly today. I really don't. I think we need to make sure we're thoughtful. And we got good staff out there. I want them being a part of this, but I think it's really important for us. Keep it simple, make it transparent. But this sense of urgency is not driven, it's driven by this disease. It's driven by the disease. We have to be able to be responsive to what's happening. That's an external force on us. Sometimes we're not going to have it all the time we want to think this through. We need to be flexible. We need to be able to be adaptive. But we have to be responsive. I mean, that's why we're, within a matter of days or weeks, we're in a much different spot. And so, yes, be thoughtful, be deliberate, but let's be responsive here in a way. And then, I just want to reiterate, and, people that are watching and our own staff and the people in this room, you choose not to get vaccinated with all the information that we have given you, with all the facts and all the data, and you don't want to believe it or whatever reason, that's fine. But the impacts to that decision, as Commissioner Fretham talked about, needs to have that connection to you and your choice, not to me and my family that have made choices. And I just feel this is such a big deal. Those impacts are going to roll off to us, and we're going to have to be a part of that. And I'll accept that, and I'll do that. I'm wearing a mask today. I wore a mask walking down the street. I wore a mask on the plane yesterday, and I will continue to do my role in that. But I also need to see the people that are making choices not to do this and put us in this position for that impact to fall onto them, and for them to have some responsibility in their choice not to get vaccinated into helping to keep all of us safe and to getting us to that spot of herd immunity. And that means we need to be pretty decisive and bold about the actions that we take forward.
Thank you.
I think that's everybody. We have had a vibrant discussion in this regard. Thank you for asking for the clarification, Commissioner Maris-Castillo, for clarifying where we are today. I see a hand up again from Commissioner Reinhardt, so I'm going to go to you quickly, and then I think we'll be moving.
At a certain point, I guess my question is, as more and more counties in Minnesota go into that category, do we know if the governor is looking at taking any statewide action?
Madam Chair, Commissioners, what I know from the context around us right now, I think Hennepin's talking about masks today and is likely to move toward a mandate. I think Dakota may mandate for employees, not visitors. I think other metro counties are going to stay on pat as currently where they are, although Washington, I know, is having some discussion today as well. I have not heard anything specific from the state that I can report at this time.
Well, and at this point, looking at the percentages and so forth, I can see that, but there is a sense of urgency here. This is moving fast. So I would hope that instead of doing it piecemeal, that if it in fact gets to a certain percentage across the state, that we can expect some leadership from the governor, as we have in the past.
So we have influence in terms of the actions that we take and the urgency with which we function here in Ramsey County. We've had an incredible discussion this morning. County manager has heard our input. Our last point is the urgency, the factor that we can impact in terms of whether we come back expecting a change next Tuesday, or if in fact, given this can be done administratively, we can expect that the county manager will act with the urgency with which we've communicated today.
Yeah, Madam Chair, I'd ask for clarity on one spot because I want to maintain fidelity to the relationship with the board and the county manager's role and function. I could say, ultimately the county board, if they want to allow for a deviation from the existing policy for a few days to move backward to a mandate now, we can do that. I would just prefer to leave here knowing that we're moving back toward the policy we previously had before we stepped it back. We could begin to sign accordingly with a policy next week that reflects that change. I would propose we can do that as soon as tomorrow, if that pleases the board, without us having to go through a bunch of hurdles in the meantime.
Absolutely.
I just want to make sure that as the policy board, you would feel comfortable with that approach. And then we will reflect that change next week on the agenda, but we'll move in terms of signage and expectation and messaging, starting today through RamseyNet, through the messages that roll out, and then tomorrow on our building.
Thank you. I appreciate your respect for the policy decision-making of this board. I do see nods, and I see a couple of hands. So I'm going to call on Commissioner McDonough and then Commissioner Manis-Castillo.
Yeah, and I appreciate Ryan as the county manager trying to get that clarity because we need that, right? Governing board, policymaking, administration, and so, to your question, I would feel very comfortable with you administratively making that based on this conversation, right? We don't always need RBAs to set policy. I think there's some alignment in this conversation that we have that gives you enough direction and standing to be able to make a decision. And then especially, with the question you just asked to see it, is there head nodding here? Is there alignment here? Because I don't believe every single policy decision that transfers to an administrative decision needs to be an RBA, right? It is about the direction this board feels strongly about. So I don't know if that's helpful or brings more cloudiness
No, that's
or
helpful. That's
fogginess,
helpful.
but I think it's important for us to understand this county has to be able to operate better than just every Tuesday, right?
And the new policy, Madam Chair, we'll reflect that in the new policy in a way that prevents this from being an issue in the future. What we didn't do is do that last time, and I'm learning that on the fly today. So the new policy will take care of this very clearly.
Thank you. Commissioner Manis-Castillo.
So we changed the policy to remove masks on June 23rd. The previous policy was the end of May about wearing, and you're just going to roll back to the end of May. I fully support that, and if you need a motion during administrative or whatever, I fully support that.
I think what we have said is that given the discussion we've had, the feedback we've provided on the suggested policy today, the county manager is taking the authority we are providing him with to go ahead and implement the changes indicated to roll back that policy to the May policy. And we appreciate your handling this with the urgency that's been indicated. Commissioner McGuire.
Clarify all of this. I'm good with all of that. And so thank you. So next week, you'll come back to us with what we've done and just some of the questions that we've already asked. I don't want it to now be just we go back to the other way. We've raised some other issues here that you're going to come back to us next week.
Madam Chair, Commissioner McGuire, next week I'll come back with a series of things.
Yeah, okay.
There will be a policy that looks very similar to what you've seen before. However, it'll also allow for administrative decision-making between Tuesdays so as to make changes to status if need be based on the world around us, and then we can revisit that the following Tuesday. That will be an ad that you haven't seen, but the policy, you understand what a mask mandate policy looks like. We've had it. We're going to move back to that. The administrative policy for staff, that can happen as of today. I can make that change. That does not have anything to do with having to come here. That will happen. We'll adjust the message that we're going to do with staff today anyway, and so we'll make that move effective tomorrow. So we'll sign buildings, we'll make that move. We'll come back and clean it up on the policy side next Tuesday to be clear that that's the direction that was discussed today and outlined. And then in addition to that, we'll come back with an approach to give employees a certain amount of time, I would say likely the month of August, to get vaccinated. I think you'll likely see some sort of an incentive structure, probably for employees that have either can prove vaccination status already, since we don't know, or to prove it between now and the date we set, with an expectation that we are giving you a ramp-up period by X date, and you can expect a policy that'll look similar to the federal policy around, and if you choose not to, then you're going to have to show X, Y, and Z on X, Y, and Z timeline. And I want to be a little light on outlining the whole thing today, but you can generally understand by reading what you're going to see next week come back.
Okay, thank you.
Thank you. That sounds very clear. Very much appreciation for the discussion that we've had, for the COVID update that preceded the discussion. Checking one more time that we have no further business in our COVID update.
I think I'm good, Madam Chair.
Thank you. And appreciating the opportunity to take a moment to meditate, to reflect on the challenges that we are enduring in this continuing nonlinear COVID-19. Thank you very much for that moment. We are going to head on into then our administrative agenda, and that would be Commissioner Tretham, please.
I'd like to move item 3, agreements with occupational skills training providers. Item 4, families achieving success today, next gen randomized control trial. And item 5, countywide unclassified limited duration appointments for COVID-19 response.
Second.
Thank you very much. We have a motion and a second. Is there any discussion on the administrative agenda? Lacking none, I'll ask the clerk to call the roll.
Brother,
Aye.
Matas Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Carter.
Aye, the administrative agenda has passed, and our policy item is a presentation update on the American Rescue Plan Act. County Manager O'Connor.
Thank you, Madam Chair and members. I'm catching my breath as I invite CFO Kutza to come join us at the table. We also do have a PowerPoint to display. Alex, I'm wondering, do you need, I can go, maybe I can come over here. I might transition over so I can see the PowerPoint.
How many counties?
Yeah, I need all sorts of help. Thank you. Madam Chair, as we get this set up, I would just open by noting that about 6 to 8 weeks ago, we had a conversation with the board about the American Recovery Plan Act, ARPA, funding, and the conversation around prioritization of funds. By way of recollection, one of the largest parts of the American Recovery Plan Act funds dealt with the disbursement of direct aid to local governments, including counties. Ramsey County is slated to receive between this year and next year approximately $106 million in ARPA funding spread across 2 disbursements, one that occurred this year in May and a second that will occur next year around the same time frame. There were different priorities and eligibilities associated with the ARPA funding and what it might be used for. And at our previous meeting, and when we have this up in a minute, we'll look at it, we discussed tiers of prioritization with the board from on a 1 through 5 spectrum of emergency needs climbing up to transformative projects that are less about the here and now. I liken it to a dam, right? Plug holes immediately because that is the immediate thing in front of you that you must do to keep things safe. Following that becomes a choice on the highest end of rethink the entire structure and what you're building for long-term resiliency and strength as a community. Since that time, we have taken the feedback that came back to us that day, and we have used that prioritized grid to guide conversations with staff, the community, our partners, particularly St. Paul and St. Paul Public Schools, who also received large allocations of funding in this space. It's also opened up conversations, as referenced previously, with like the Met Council around some of their funding and what that might look like. Today is not about a lot of the partnership pieces. It's actually about where specific actions are poised to come forward here, and we wanted to check back in on all of this work. There were a number of tier 1 priorities, and the way we approach this work, every organization is taking a slightly different approach that's appropriate for them about how to approach thinking through the ARPA funding. And I know that one of the things that has also happened is all of you have received many suggestions from many different areas that have an idea of how you should spend or prioritize the funding. Some of those suggestions align very well with the previous conversations that the board has had. Others, we're not questioning the significance of COVID. We're not questioning the significance of the moment in which we sit. It's more an issue of, while $100 million sounds like an enormous amount of money, when we think about it through the lens of transformative change, investment, and being sure to make thoughtful choices about where you want to bet on the future without creating 106 different $1 million fiscal cliffs, it does create a bit of a constraint very quickly overall on where we stand in terms of thinking all of this through. And so to that end, we began to go back on those tier 1 priorities, and we asked staff and departments to develop proposals around the different areas, not only as how would you fill the dam, but if your proposal also involves upstream work, how do you build upon the tier 1 piece and think holistically? And I think we may have lost our PowerPoint. That's okay, I can continue to go. There were a series of principles that we applied as we asked departments to go back and begin to design the work. First, we said, please think holistically in the term of an arc of a biennial budget cycle. It's hard for me to justify to you funding developments or proposals that would end, for example, midway through this year or midway through next year, where there's clearly not an easy recourse to make a decision then about whether or not the thing that you were funding should be continued on in a longer term period. And by aligning all of the proposals with the 2022-2023 budget biennium, it allows conversations to come back here during that budget cycle planning for the following biennium about the level of prioritization, lessons learned, and decision-making that those different proposals may have engendered and may therefore be important to sustain. So there still will be moments where there are clearly fiscal cliffs being made, but they are aligned in a way where you get to make choices as to whether or not it's a cliff that you choose to surmount, or it's one where the investments being made should be viewed as one time. We are now up on the screen. Perfect. We've already talked about ARPA generally and what it looks like, so we'll pass by that. Alex, I'm going to slide back to my seat. Can you slide to the next slide, please? Thank you. This is the prioritized funding piece. We've used this example with all of you before. It's helped actually to shape conversations with other counties as well and municipalities. As we mentioned, people in need tier 1 is a lot of where our focus will come today. You'll see highlights of exactly where on the chart we're having the conversation. These were the tiers brought forward previously as a part of our conversation a few months ago. And as a part of that, the highlights are areas where we are bringing forward the idea that in the coming weeks, you are going to begin to see requests for board action that relate to ARPA funding. A couple of points to note here about what is or isn't highlighted. The public health ongoing response has had access to different federal funding streams. It's not as though we don't see it as a tier 1 priority. It's that there's been many different ways to continue to fund public health. So in the context of ARPA requests for board action potentially coming forward in the next few weeks, it's just not one of those that has risen to the top, which is a good news thing. It means we're not having to draw upon these resources necessarily to address it. You may remember we talked about the X in the 106 plus X in the bill. Public health is one of those areas where there is X. There's extra funding beyond the direct relief to local governments. In the area of employee compensation, this is a piece that there's been guidance that has come out within the last month around who is and is not eligible in this space. It is more restrictive than we initially assumed that it would be. It would not cover all Ramsey County employees. These are important distinctions that we cannot move on something without knowing these pieces. Our conversation like we just had too about how we want to think about employees as it relates to COVID response, vaccinations, all ties into some of this. So it's an area that we continue to think about and want to talk about, but we're not yet at a point of bringing forward a substantive proposal of any kind for the board to consider in August. Emergency shelter expansion to 2022 is also not highlighted here. That's in part because it was previously funded using CARES funding and then cobbling together other resources to create a project account, $20 million to get us to the spring of 2022. This was put on here in case we saw significant gaps in the existing funding of the system. We remain within amounts where we believe right now contingent accounts and the way we've planned keep us on that path and trajectory. So again, it's not that we have an urgent need to infuse additional money into the emergency shelter system in the near term as a part of tier 1, but it still remains a tier 1 priority to ensure we have a system with us through this fall, winter, and into next spring. As I look to the right on this chart, tiers 2 and 3 will be a part of our budget discussions to come back in the coming months. You're going to hear a proposal that would spend what I would say is a significant fund of the initial ARPA funding to be able to ensure that we preserve and enhance services as a part of our budgetary response over the next 2 years. That is an intentional part of the strategy, so it's not here. It's not going to be an individual request for board action. It'll be a part of the budget presentation that begins on August 24th and carries into the first 2 weeks of September. As you look at tier 4, I would argue that violence prevention is the one that has seen the most significant movement to the left on this chart since we originally talked about it. It is clearly an area that requires partnership with other entities. It's clearly an area where there's a lot of focus, but there are immediate pieces to that need that put it actually closer to tier 1, I would argue, than when we initially spoke about it. That is how it has risen to the top. We're going to talk a little bit more today about some of what you might expect. In the areas of food basic needs, childcare assistance, financial assistance, you've heard CARES reviews in the last number of weeks. We've been having discussions with all of you about where that work may head, what it looks like. There's no immediate ARPA funding ask. Greater MSP continues to meet with us on economic development post-pandemic. We're trying to still figure some out about where DEED exists, the Department of Employment and Economic Development, where they will sit within this ecosystem. That work is also ongoing in tier 4. And along tier 5 is the housing supply piece. And there are parts of housing supply that are both tier 1, as you're all very aware. It's also transformative in the conversations we've had about tier 5. And so that's how it shows up kind of in the temporal arrangement of like, we need to begin to do things now while setting the stage to continue to do things throughout the life of the ARPA funding. On the areas then that are upcoming to move ahead that were highlighted, we've developed a cadence to be bringing forward requests for board action to the board as opposed to trying to talk about an entire package on one day. As many of these initiatives are discrete, we've been trying to have ongoing conversations with the board. The way in which we plan to bring proposals forward would be a series of 2 steps. The first time would be policy discussions with the board to recap conversations to date and the approach to use ARPA funding with no ask for an action at that time. The following Tuesday, assuming the discussion goes well and we remain aligned with what the board believes to be the priority and direction we plan to go, it would show up as an administrative item on your agenda. For example, in the area of housing supply, you'll have a policy discussion next Tuesday that is slated to happen. No action to hear the full request for board action and the proposal, and then it would be set to vote on the 17th as an administrative item. It also gives a chance to daylight each proposal individually and show the thoughtful nature of how we're trying to weave this work in as we go. Here is a list of the proposals that I would like to preview are going to be coming your way in the coming weeks. Workforce development, you've already actually seen. The Right Track Plus program was approved back in June 2021 for $2.1 million. As a part of that, I would also note that Ramsey County was matched with 23 interns working across 11 departments. That work begins on August 17th. So this is not only a benefit that happens outside of our walls, it's actually one that will benefit our organization internally as well. Thank you for the fast movement on that to meet students during the summer employment opportunity window that we have in fact had. Affordable housing has been a topic that we talk about almost every week in every different thread of how we're thinking about well-being and prosperity. The first movement here, a little bit on the administrative support side, although I would say that's a pretty small part of what's needed foundationally to be prepared to receive funds. And then the first initial capital investment in affordable housing to come forward. In some ways, this is the trickiest part, is trying to both hold funding for that while meet immediate needs as they emerge and all the changes happening around us at the same time. So this is not meant to be the full swing at everything in affordable housing. It's meant to be the first piece to begin to roll this work off the ground. And Director Collins will be here next week to lay out and discuss the full proposal. In the area of violence prevention, there are two areas where the work has honed itself to being tighter, both in our individual work and in our work with a collective. The Healing Streets program is showing positive results in a number of areas, but we've never gotten to full ramp up yet of that program. And that was always a phased, planned approach as a part of the budget cycles. This is a proposal to ramp up that accelerated timeline for violence interruption strategies, both on the street, in hospital systems, in alignment with our schools, to ensure that we are putting all hands on deck and bringing every resource to bear on an immediate and present need in the community to ensure that we are interrupting the cycles of violence. So the Healing Streets program is one part of this. The second, you received an update, Deputy County Manager Scott Williams helped to lead a number of weeks ago around alternative responses to 911 and the role of the Emergency Communications Center in that, and on the staffing side as it involves social services, for example. We believe that this is something that we should move forward with. We believe it would have significant and profound and important changes to how we respond to calls and change the way resources are deployed across the community, change the way in which those calls result in better outcomes, both for the responder and the respondent. This is a significant proposal to move in terms of its size, scope, and scale, and yet the development work shows that we are poised to do this. This is a good example of one where you have to align it to a budget biennium to have effectiveness. Otherwise, if you don't, you could end in the middle of a year with no real plan for what to do. So right now, on the violence prevention side, I would assume this is on the back end of these proposals coming through, end of August, early September, as we finalize numbers and really make sure we're bringing forward a holistic proposal. It also needs to align with conversations you've probably seen happening in St. Paul about an Office of Neighborhood Safety. What does their work look like there? We continue to talk to our other cities as well to make sure their law enforcement agencies are well aware of the work happening and are well aware of how the protocol pieces would work. We need a Ramsey County response when you dial 911, not a city-by-city approach, as was discussed and prioritized here by the board. In the areas of the racial equity and community engagement response team, the areas that we want to ensure we have funded fully through the next biennium include trusted messengers, resiliency and recovery, the continued support for the Equity Action Circle. These are not, from a relative perspective of funding, these are not massive amounts of money. They're significant, but they keep the fabric together. And honestly, what you want to see, I would propose 2 years from now in the budget is, how does Trusted Messenger become an embedded part of the communications approach going forward out of COVID? How is this not something we do in addition to our other approaches? How is this a core part of the focuses that we in fact have? And that work is underway right now, and this is part of that building the bridge from where we exist today to where we would end up. That request for board action is likely a week or two behind the affordable housing piece that'll come next week. So that's one you'll see very soon. And embedded within the racial equity and community engagement response team request for board action will be the family coach model, which is a piece specifically around working with families through a coach model. This has been something that through the Equity Action Circle and different community engagements we have had throughout COVID, this has been a tier 1 priority for community members of, can you please work in ways with families? Because as we think about, and this will integrate with our navigator approach, that'll all be part of the conversation of how this piece comes in. Families, as many of you know, knit together multiple areas of the organization in a more complex way. And this is an opportunity to think that through. The Department of Human Services is also funding some of this through a grant program. This is the final, these are like the last pieces in on the dollars inside to fully fund the coach model and get it up and off the ground. Very excited about that piece of the approach. I'm going to pause, Madam Chair, on all the proposals because that's a lot I just threw at you, and I know you're going to get more specifics as we go, but I hope it's helpful to at least have outlined them a bit.
It is a lot. It does help to see a strategy for upcoming meetings whereby we'll hear the presentation, we'll have the opportunity to, in the following week, then vote on the proposal and to see this set that you'll be putting before us. I see questions from Commissioner McDonough and Commissioner Manis-Castillo, and we'll go around.
Yep, thanks, Madam Chair. On the trusted messenger, very supportive. I just want to, Commissioner Ortega said something really important earlier in the earlier discussion, right? You know, as we're building this trusted messenger and as you say, embedded into communications, one of the pieces we need to always be thinking about is we need to utilize that work to eventually where we are one of the trusted messengers, right? We're not just, you know, connecting with community to do our work as trusted messengers, that we're figuring out how we can build that trust with community, that we are viewed as a trusted messenger as we're moving along on that. I think it's really important, maybe a little bit clumsy said, but I think we need to make sure we're always looking at that because if in the end we just build the silo of trusted messengers to get our work out or to, you know, utilize the relationships within the community, we've missed an opportunity here to elevate what we actually do in the county. You know, the top 4 bullet points, very familiar with, this has come to us. This family coach model is new to me. I'm not sure I've seen this. You mentioned it's been a tier 1 piece of this, but I have not seen that. So, you know, before you talked about, my question was like, what else was there? How did this get elevated? Because this is the first time we're seeing this before. You're telling us we're going to get a board action. I don't have a good sense of what other things, you know, were a part of this to get elevated, or how we're going to pull up things like this that we haven't had a lot of conversation about, or are new to this, and all of a sudden we're moving into a direction of funding.
Thank you, Madam Chair, Commissioner McDonough. So a couple of thoughts. This was one of and there's been a lot of different recommendations coming forward through different ways. I want to acknowledge that this is one of the top recommendations that the Equity Action Circle provided in the report that I will make sure gets recirculated here to the board so you can read a little bit more about that feedback and what it says. And I'm getting a head nod from Sarah, so we'll make sure that happens out of here. This is also why we want to time these as discussion items first, and then to set up for the following week so that we can talk these things through and we can hear if we're in alignment going forward. I didn't actually want to just bring them forward as a thing and say, this is the way, we've got it all figured out. Because there are so many different threads, things along the way can weave together differently. I don't know of, well, first of all, I should acknowledge, I didn't know that this one might be viewed as a surprise, so take for what I'm about to say with that as the opening comment, which is I don't know of others that would be viewed as surprising as we go, but one of the asks over the coming month as we go through these is if there are areas where it says, hey, this feels new or we don't know this as well, maybe we should move this, but can we get a little bit more on that? That's part of what we're going to feel out here as we go and try and have this iterative process of moving pieces forward together in the coming weeks.
Madam Chair, if I
Go ahead.
And I appreciate that. I guess from my perspective, you know, the surprise would be having an understanding of what didn't get elevated, right? What are some of those other pieces here? and then the decision-making
Got it.
about how we elevate or move something forward. Because I have, you know, I guess maybe I haven't been paying attention, but I haven't. All these other four, we've talked about a lot. They've been a part, they're highlighted in the slide before, right?
Right.
This hasn't been in a slide that I've seen before. But for me, you know, you say you're surprised that this got some attention. I'm not sure what didn't get attention and how did this weigh out. So as we're moving forward on, you know, the RBAs and the expenditures, I think it would be helpful, at least for me, to have a sense of, you know, right here, there might be 10 things, right? And then here we're 5, and then we're here at 1. And then you're coming with the 1. I want to get a sense of what are the 10, what are the 5 in the process that we got to 1 on.
Madam Chair, Commissioner McDonough, one last point to clarify too, what you'll see, so in some ways this almost would have been better written as the RECERT RBA and not listed it individually, but we did want to highlight it because we're excited about the work. It's going to come forward in the RECERT RBA, and what you will see in that RBA, and this is good feedback that we can make sure is fully there are a number of items in there that have come through the equity action work that are being embedded in budget proposals coming up and other spaces as well. This is one where we're the final dollar in on a gap financing piece, which makes it a little unique, and so we're calling it out here. We will make sure that the write-up in the executive summary is clear on all of this for the reasons cited, and that's good feedback.
Thank you.
And thank you very much. Commissioner Matis Castillo?
Yeah, thank you, Madam Chair, and thanks for this update. I want to go back to the slide about our tiers, and when you mentioned that emergency shelter is not highlighted, of course, I always panic a little. And I know that we have funding until spring of 2022, but that comes super fast. And so what I'm wondering is, are we thinking that we will revisit, maybe highlight that in the second half of our funding? And here's my concern is, we know we have the eviction moratorium is expired on the federal level. It is coming on the state level in months soon. We don't know what's going to happen, and those shelters are going to be really critical, especially for families. And I don't want us to get caught flat-footed, and that we don't have an opportunity when we had money up front to say we need to extend this, especially as in conjunction, as we've talked about our housing stability office and the continuum. We can't crush one part of the continuum as we're trying to build. We need them both in place to keep that balance. So that's my one concern, is that it's not, you know, it's not highlighted, because I think this is something we can't take our eyes off anytime soon, especially as we're investing upstream, and we have to, that's a careful dance to make sure that we're not displacing anyone, because we've done some really incredible work with standing up our shelters, and they're in a good place, and we certainly wouldn't want to just pull that rug out quickly.
Madam Chair, Commissioner Matis Castillo, I think this is a good question. So as of right now, I didn't say this earlier, but as you look at the $107 million and the initial proposals and where they all came in, I did mention this briefly in passing, I think in a workshop or something about a week ago. Our numbers come out to about $117 million of design back, and so now we're in that process of don't have the extra 10 million. I don't think the federal government has just released bonus money anywhere. How do you winnow that? And that's okay, that's a part of the process. But that does not reflect a continued expansion, running a shelter system that is running almost $1 million a month above its current capacity pre-COVID. And this is a very real, I want to highlight this because I share the same concern. I think it's important that we daylight it everywhere we go and continue to talk about the partnership and what the future of emergency shelter looks like. There are a few ways to approach this in the weeks ahead, and we can begin this conversation some even next week. The board has the flexibility here through the A and B funding to choose not to do as much on the supply of affordable housing to fully extend the period of time by which the emergency shelter exists. But it is absolutely a trade-off, and I don't want to set it up as a choice that we have to make today, or in some ways I hope it becomes a false choice and that we find a way to bring other resources to bear. The current effort has been to take the $20 million that the board invested to make the program last until April and make sure it can sustain even as we think about ways to make that system run more efficiently. For example, we started with hotels with a week's notice. It's not the most efficient way always to run a system. We've learned things. We're working with Union Gospel Mission and Catholic Charities around their plans right now. That's finalizing all of that work. There was a piece last night, Deputy County Manager Berg and I were going back and forth on trying to figure out the exact plan to April. And we look forward to sharing that soon to lay it all out very clearly of here's how we get from here to there. But the cold reality we are facing as we enter the summer of 2022 is we're running a shelter hundreds of beds above capacity. And it is a massive cliff, and I do not come to you right now with an answer for it. And that's hard to say because these are people that need a place to sleep. And I think as a state, as a region, as a federal government, this needs to be the top priority right now. But the board does have the flexibility, should it choose to change course. It could invest additional resource in emergency shelter relative to affordable housing, and we're going to hold that flexibility through this process so that there is at least an option, and you're not saying we never even had a choice of where to lay on some of this.
I appreciate that, and if I might just continue, part of it is we're doing a ton of work to go upstream, right, with the HRA levy and implementation, but we've got like a year gap. Our timing's not quite right? We won't have funds from the HRA levy till 2023. We know how long it takes to build housing from a county entity, and so I think that we do need to carefully consider how we, very carefully divide that recipe so that we don't inadvertently cause a 9-month gap where we're sending families back to the street. And so I want us to keep us on, and I know there's a ton of work going on behind the scenes. And I'm in particular concerned about, yes, the hotel programs are incredibly expensive, but we have a few other shelters that are running extremely well, that have been set up with partners that we need to continue to kind of keep funding with families and, at the Sisters of Condoleezza partnership and the partnership with Luther Seminary and Bethesda are really good examples of what's working. And we saw last week in the evaluation processes, this model's working, and we haven't had that success with other partners in the past. And to help our partners get to a model that's working so that we can carefully do that dance. And I agree, we can't sustain this forever by any means, nor is that the intent, but that we just are careful as we're moving in that direction.
Madam Chair, I'm sorry.
Go ahead, if I could add this, I want to take this back to our conversation on the COVID update, right? I mean, part of how we start moving back is Catholic Charities and Union Gospel can start moving back to capacity, right? They couldn't be at capacity because we're in a pandemic and we had to respond in distance and we had to build shelters for respite care and all these things, right? And all of a sudden we're peaking up, right? Because people made choices not to vaccinate. And now we're going to have a conversation. Are we going to continue to spend $1 million a month more because Catholic Charities or Union Gospel may be hesitant to start moving to fuller capacity because we've got this spike in COVID going on in our community? Or we're going to continue to have to invest in respite care options and isolation options because we continue to put people in our community at risk. And so there are these consequences that don't always have these direct ties to choices that are being made. And that's why I wanted to take a moment, because I think that is a part of what's going to put us in this, position at some point about where and how do we invest? Can we get upstream really quickly, or are we going to have to kind of hang around down here because we're still having to protect people in our community because the rates are so high because people are making choices to put people at risk in our community?
Madam Chair, Commissioners, just really quickly on clarification. I know there's been some concern from some of our community partners and providers about shelter and sustainability. I just want to allay those concerns. There is no plan in December to end the system in the middle of the winter. And there's some communication ongoing on that pieces. And so I'm not sure where the disconnect exactly came from, and we'll own that on our end of maybe it's something that happened here. But we're working to make sure that there is a robust thing. So I'll just say that here with everybody here. That we'll make sure that we aren't having people outside. The other piece, just on the funding and the ramp up, that's why next August 17th is going to be the first investment in a more affordable housing funding, is to not wait until 2022 is when the levy would kick in and begin to finance. But that's why next week is the goal. And the final part to that is ultimately the question right now that I hope the state can grapple with, and we can figure out how to have this conversation, is there is an increased appetite in affordable housing supply need across the region. I see head nods. I think others would agree. There's a 5-year window, though, between the existing world today and a world that has that, and someone needs to help us in transitionary supports for people. And I don't know how you can ask your local governments to do both this, and this is our challenge right now. And so I'll leave that as the piece in front of us that I think we need to keep trying to work through.
Thank you. I know I have Commissioner Fretham, then Commissioner Ortega.
Thank you. I just want to note, I think we haven't talked about the family coaches in that way. We've talked about the preschool development grant, which is where the family coaches come from, and we approved that funding in April, accepting that grant, and that's what's funding the family coaches. And I know Commissioner McGuire and I, in our work on the child care subcommittee, have received more information about that. But that model is something statewide that comes from federal funding through the state. But I don't think we've used that phrase maybe at the board meeting as much as we've used preschool development grant. So that might have been part of the confusion there. I want to talk about the violence prevention. I'm really excited that we will be funding some of that more quickly. And to your point, how do we interrupt the cycle of violence? I see in Tier 3 and prioritized budget amendments, the analyzing program and project requests aimed at restoration, and I think that needs to be a part of the budget cycle. And to me, I'm not talking about restoration as how do we put things back to where they were, but thinking more broadly, what are we doing for repair and healing and transformation? And when it comes to violence, part of that is how do we prevent trauma? And there's a direct tie there to the housing work that we're doing, that we know housing stability is a direct contributor to trauma. Violence and violence exposure is a direct contributor to trauma, but also what we've been hearing about in the CARES funding in our discussion last week about, how it is so challenging to get services, how services are so confusing. Like, that's another big piece of that, and our work to move to a more residents first model. So as we're talking about that budget, using that lens of restoration, I think is going to be really important and help build and help us prioritize those budget pieces and where we invest. And I actually think there's opportunity there, or I hope there is, around that employee compensation piece. Compensation is dollars, and I do hope our staff get dollars they deserve, but also just more broadly, how are we focusing on restoration with our employees who have been through significant trauma in their work here over the last year and a half? You talked about people who've been there since day one on the incident response team, and how drained folks are. So how are we, is there opportunity for that healing and restoration to be potentially tied to our TARP work and make that even more holistic so that we're supporting our staff who are supporting our people? And is there a tie there? And so, I see this language in a lot of the proposals. So just an ask to, as we go through that budget, how are our budget priorities being tied to restoration and healing? And that down the road prevention is something that I'd really like to see that really tightly and explicitly laid out for us. Because sometimes when we talk about restoration and restorative practices, we only talk about it on the violence end and the criminal justice end, but it really needs to be embedded at that beginning part when we're talking about being trauma informed and we're helping people before it gets to that point of violence. So for me, that's what one comment I have just in terms of when we get to those Tier 2, 3 discussions and our budget priorities.
Thank you. Thank you very much. I think I saw next Commissioner Ortega. Yes.
I just wanted to react to what Trista, Ryan, and Jim stated. That's why I was saying that's in the previous discussion. Everything around the table that was said, I agree with my colleagues. To me, the question is, let's make sure we don't flip-flop, that we take the time to look at all the pieces rather than talking about the pieces separately. And with the homeless and the housing, that is a concern. We need to monitor what's going on now, because it's hard to predict where we're going to be given all the other federal and state supports that might be withdrawn. Where does that leave? We're left with the issue, quite frankly, and we need to make sure that at least we have enough time to be advocates at whatever level we need to be moving forward over time. And then the budgeting process. But something Jim said, I think, is also, which answers kind of your questions. Ryan, you stated that we can't do both. We can't start building affordable housing and deal with the emergency crisis. Somewhere along the line, something's got to give. I think part of that solution is the example. I'm not picking on Catholic charities, but other folks got to start stepping back into the roles, into their roles, because they're not fulfilling all those roles right now. In many ways, COVID has been a cover for some of these other organizations to sort of, almost you sort of go after the low-hanging fruit because everybody's in a survival mode. And we need to start making sure that it's like, the county's doing it so we can step back. They need to have the same urgency that we have on some of these issues. I just wanted to make that clear because it's all connected, and we are not going to have the resources to do everything that's on these lists. We're going to hit the wall in a couple of years pretty hard.
I appreciate those comments, and I do want to say we're going to have time for these conversations. It's going to be very important that we're able to hear back within our ARP discussion how these issues are being handled, and also understand how they will reflect in our budget discussion and moving forward for transformation, for restorative community, for building the kind of partnerships and relationships that we need respectfully with our partners. So we'll have those conversations, likely not this morning because we have a lot more to do. I am going to call on you, Commissioner McGuire, but we'll be moving quickly forward in our agenda.
Thank you, Madam Chair, and I'll just bring up a couple things, and I know we're going to be talking at this at greater length, and I appreciate that. I appreciate Commissioner Fretham bringing up the early childhood proposal, which is where we did hear about a family coach model. I think of it as family stability, so I think we've been calling it a number of different things, but we did get a specific grant, and I appreciate Commissioner McDonough bringing it up, but I'm anxious to hear more about that, and I'm excited to see it on here. There was just one thing that you mentioned, County Manager, at the beginning on the reminder, the summary chart, and you said, I think in Tier 1, that there were more, it was something about the CARES dollars was needing to be more specifically pandemic related, which it is, but that these things, that they were even more specific, that some of these things had to be more specifically related to the pandemic. Was that just CARES dollars, or is that some of the American Rescue dollars?
Madam Chair, Commissioner McGuire, the CARES Act definitely was more
Right.
specific to very clear point in time pieces to the response. ARPA is a little more varied in some of that about how the money can be expended. I think the part that maybe I was referencing had to do with the employee compensation and the idea that we thought we would have a wider definition of employees that would be eligible than what has come back in Treasury guidance since.
Okay, thank you. Thank you for that clarification, because I did hear you say that, and it was just specifically to the employee compensation.
Yes, ma'am.
Not to everything. I was a little nervous about that. Okay, thank you.
So I want to thank you all for this broad discussion, and thank you, County Manager, for bringing this plan forward. Clearly, this is an introduction, and it tees up the conversations that we will be having in coming weeks. And so lots of considerations for the content there. We have a little bit left on our agenda. I'm going to call on the County Manager briefly again for County Connections. Then we'll have very brief outside board and committee reports if you have one to give today. Before our adjournment, we've got a lot left on the agenda this morning, including a regional rail meeting and also a workshop, and no time to push things to the afternoon because of a closed session and a workshop. So I want to call on you first for County Connections, and then we'll go around very quickly.
Madam Chair, my only question is if the CFO wants to add anything to the ARPA conversation, I'm going to give her that chance.
Oh, good. Thank you.
In the interest of time, I'll just
Okay.
But we do, the one thing I want to note with that, we do have the emergency rental assistance funding, which is over $7 million.
Thank you.
Thank you.
We also have received over $3 million from the Minnesota Department of Health related to our COVID and pandemic response in that space. And we've gotten some money from FEMA, and we continue to look at that as a source of funding for potentially the homelessness and the shelters. That's an area we're starting to explore more.
Very important additions about the X pluses. I appreciate it.
Nothing else from me, Madam Chair.
Thank you. So I'll call on board members briefly, beginning with Commissioner Mariscal.
I'll just say tonight's National Night Out, so if your neighborhood is celebrating, go out carefully, social distance, wear your masks.
Thank you. Commissioner McDonough.
No report.
Thank you. Commissioner McGuire.
Thank you, Madam Chair. Just two things quickly. The Roseville Business Council met. We were hearing from the school districts about their work with businesses to have opportunities for for high school students to learn a trade that will help them find a job later on. And they gave kudos to Ramsey County, to Director Lingbecker and her team with our workforce solutions work that they're doing. And Ling is coming to speak to our business council next month. But kudos all around for the work that they're doing with our school districts in helping our students have skills that are needed for jobs. Also, just the Mosquito Control Board met, and just want to remind people, don't have standing water in your backyards and wear mosquito repellent because the West Nile virus cases are up. So just watch out for if there's nothing else to worry about, you can worry about West Nile.
Thanks for the reminder. Commissioner Ortega.
No report, Madam.
Commissioner Reinhardt.
Very quickly, I attended Commissioner Frotham's Rice Creek Commons Dialogue Circle last night. Great job and great conversation. And the last Market Fest for this year, anyhow, is this Thursday, 6 to 9, White Bear Lake, and it's just a wonderful event.
Be there or be square. Commissioner Fretham.
Yeah, we've had 2 of the 6 planned dialogue circles. They've been really fulfilling and delightful and engaged conversations, so really enjoying those. The next 4 are the following Friday, so the 12th, 13th, 14th, and 15th of August. Thank you, Commissioner Reinhardt, for joining us and participating, and other folks are welcome. We just ask that you contact Sheena, if you're an elected official, my aide, to ensure that we don't go over quorum rules. Other than that, I also had the opportunity to tour the Project Home site at Sisters of Carondelet. It's beautiful. I'm really grateful for their work and efforts. Thank you.
Thank you very much. Well, I will just mention that I took 3 days off at the lake, interrupted only by a call with the county manager during that time. And so I'm going to pass this up. I want to trade with Commissioner Ortega, who will have a regional rail authority meeting, after which we have a board workshop together with Sheriff Fletcher. After that, at 1 o'clock, we have a closed meeting on a legal matter. And after that, with Commissioner McDonough, we have a committee of the whole for our EGCI, which is Economic Growth and Community Investment. And with that, and no further comment, our board meeting is adjourned. That was nice, wasn't it?
Gentle.
Last time it was kind of loud.